Welcome to our webinar today, Social Return on Investment, Finding Your Organization's True Value. My name is Alison Mullen, and I'm the Manager of Communications and Marketing here at Essential Skills Ontario. Just very briefly before we get started, I just wanted to provide you with a few technical instructions. At the right-hand side of your screen there is your dashboard, and in there you can chat with each other and ask questions in the questions pane. So if it's a technical question, myself and our communications coordinator, Amber Haas, will try to answer it for you and assist you. If you have questions about the content of the webinar, ask at any time, and I will make sure Sean gets asked it throughout. We'll also have some time at the end of the webinar for Q&A, as we wanted to make it try to be as interactive as possible. And if you'd like to participate and keep the conversation going on Twitter, just use the hashtag ESOWeb. So now to introduce our presenter. Hailing from Newfoundland and Labrador, award-winning international speaker Sean Wiltshire has been working in community and economic development for over 20 years. Personally, for the last 20 years, Sean has been the Chief Executive Officer of Avalon Employment Inc, or AEI, an employment agency for individuals with intellectual disabilities, assisting his clients in finding over 65,000 hours of paid employment each year. From Sean's humble start as a summer student, AEI has now developed into a powerhouse social enterprise, realizing $3.9 million of business each year. In an effort to broaden his commitment to support employment beyond his home shores, Sean was the founding president of the Canadian Association for Supported Employment and started the National Conference on Supported Employment, currently celebrating its 18th year. Sean's commitment and vision has been celebrated with numerous awards and accolades, including being named one of Atlantic Canada's top 50 CEOs by Atlantic Business Magazine, as well as being nominated for the top 40 under 40 in Canada, as well as being the inaugural recipient of the Canadian Association of Supported Employment's Wiltshire Award of Excellence in Supported Employment, an award named in his honor. So there's much more I can say about Sean, but in respect of time, I'm going to pass it over to him to start the presentation. Please take it away, Sean.
Thank you very much, and welcome everybody. I always feel when the resume is read out, I should have my mother there to hear it, so that she knows that you've all done a good job. I really want to thank everybody for joining us for today. The opportunity to talk about what we discovered during our social return on investment project was really a process that I didn't really think we would get the full value of when I started. As you'll see throughout the presentation, we were part of a process and a pilot project that we engaged in, and we knew we wanted to be involved, but we really didn't know what our results were going to be. So I guess the first thing I wanted to say is a little bit about our organization. Avalon Employment, we're a not-for-profit supported employment agency. So we help people with developmental disabilities seek, secure, and maintain employment in the community. We serve a small portion of our island. For those who are familiar with the province of Newfoundland and Labrador, we serve the central metropolitan area. So it's not a huge community, but for us it does draw on about 250,000 people, and that gives us lots more than enough clients to support. We offer lots of different services, but we really offer on-the-job supports, a job trainer or a job coach, or natural supports that support the individual that is in the community working in whatever kind of ways that they're going to need some assistance. We also have had, really good success with, how long it's taken us to get here. It has been 20 years, but a lot of the folks that we dealt with, we were told that they would be unemployable for the rest of their lives. And just recently, we secured our 1,000,000th hour of paid employment. So it's really a milestone, not only for our organization, but for all of the folks that we work with. So this process came out actually through a conversation at another meeting, and we're all aware of how that happens. We go to a meeting, we start talking about one thing, and we hear an idea or a concept that we're not really sure of, but we'd really like to get involved in. And this one was about how do you demonstrate value, both to your funders, your stakeholders, government agencies, just a way to demonstrate what you're doing. And we were at a meeting where we were talking about finding ways to show that investments are proactive to issues that are going to happen. So we were almost taking the line of an ounce of prevention is worth a pound of cure. And we were saying that we know that providing somebody with the employment supports to be employable and to get a job means that their long-term attachment to any income support programs would be able to give the opportunity for people to be able to say, I have a job, I'm not dependent on the community, I'm independent, I live in the community. So it's more of a fully participating citizen. And so at this meeting they decided that we should have a committee. And of course, you know, in the not-for-profit we all laugh. Every time there's a crisis we strike a committee. But this committee actually set about to try and figure out, was there a process that we had heard about, social return on investment, and could we engage in that process? We originally engaged with a couple of partners, the Community Sector Council, which is kind of like a think tank in our province. They do a lot of policy work on social issues and how to address social problems. But we were really looking for how to link the economic things that we knew were a result of the work that we did. So we've got engaged with this process where we engaged with a consultant from England called the New Economics Foundation. So we had 14 groups in our province, not-for-profit, community-based groups, even a department of government. We were all lumped together and we were going to do this pilot project together, each one of us working independently. When we originally started the project, we talked about that it was going to take 28 days throughout the next 16 months. Well, I can guarantee you it took more than 26 days because it became a process that we loved to get started on because we were finding out the information that we'd never had before. So when we wanted to start talking about ways to store true value to government, we started talking with the words that they're using, the cost avoidance. If I can spend $5 this fiscal year to save 10 next year, that's a good investment. So really it was an ounce of prevention was worth a pound of cure. But trying to develop this into a proposal and into a reporting structure for government was difficult because we always keep asking, what does government want? As not-for-profits, we're all well familiar with the, you know, the budget lottery. Was your group this year picked as the group? Seniors, people with disability, other groups within the population. We all wait for that day during budget where that organization or that group of people will be given resources to sort of answer some of the questions. So you never always know what government wants. They do want accountability. They wanted a responsive program. They want transparent. They want productive. But they understand about the program is that they don't always see the value and that there are competing interests for them. So we really tried to figure out it's not about working harder, it was about working smarter for what we do and the processes that we use. And I should say that in the very beginning, as the director of this organization, I was more interested with the number. What number could I use? What number would I get? And what number could I use with government to both demonstrate that, yes, we do good work, but also how that good work had ripple effects. And we've always struggled because when you're dealing with human and humanity, you end up talking to government about what a person is worth. And the worth of somebody to government and the worth of somebody in the community are two completely different things. And so we really, really wanted to make sure that not only were we doing the best job, but that we were addressing the things that our clients and the folks that we wanted to know. And the very first thing we learned was it was all about how we viewed it. It totally was about perspective and where we were as an organization. We were entering our 19th year. We have been very successful. We had continued to do satisfaction surveys with our clients and engage to see what areas that we could be improving. Well, what we really discovered was is that while we were a great organization, there were things we could change along the way. We questioned ourselves. The very first thing you have to do with a social return on investment is, why do you do this work? What is the benefit? Why is community asking? Well, we have a fundamental belief that everybody is equal. Everyone can work with the right supports in their community. And the definition of success for everybody varies. So these were things that we dealt with every day, but trying to translate that into a fiscal framework or in a framework that government could count was a challenge we had not been able to meet up till this point. We always say, too, that government needs to understand there is a price to excluding people. And while that price may be smaller in some economic terms, it's very large in social issues. So we started to ask ourselves these questions. So we really decided it was time. It was time for us to start talking about what we did in a way that gave it an economic value versus always talking about the good work we did. So the next question we all talked about in our office, but how do you measure something? How do you measure somebody's well-being? How do you measure somebody's value of worth? Well, we discovered through our proposal and through our project that social return on investment really takes a good hard look at what it is you're doing and then assigns value to it. So as an example, we don't get credit for all that we do. Throughout this process of 18 months, we talked about who's responsible for the work, who did the work, what work would have happened anyways. So we learned that when we started the process, we can measure it. And, we can and we have. And that's really what the social return on investment was about. The number was important, but the process to measure was just as important. Not everything that can be counted, and not everything that counts can be counted. So we were really trying to get government to understand that we valued things differently than they did. We valued somebody's self-worth. We valued when we could see a change in somebody's employability, when they were able to successfully hold a job, increase their job, or move on to another job. We were increasing the value of the small investment that the government had given in the beginning. So what we discovered that as we went along was knowledge is power. We had lots of information up until this point. We'd done surveys, we'd done engagements, we'd done focus groups, but what we really hadn't done is ask some serious questions about the services we provide. And by asking those questions of people in the past, we usually hadn't asked. Government was usually in the practice of asking us, what are your processes? What are the things you're doing to engage your clients? But we weren't really always asking the clients, is there anything more we can do? How has things changed for you? What's different in the last 6 months? So for the SROI analysis, well, we wanted to think about the social return on investment as a way of reporting on the social environment and economic value created by an activity. Where previously government would give us a grant, we would spend the grant, we would employ a number of people, we would find, lots and lots of jobs in the community at private employers. So we wanted to know, what was the value of that to government? So it considers more than just the economic growth as a target of progress. It asks what's important to the stakeholders. And for us in our study, our stakeholders were the government of the day, who collect the taxes, federal and provincial, and the individual we're serving. Those are the folks we serve. Now also through this study, we found out that helping somebody get a job affects more than just that individual. In fact, as we counted backwards to the people who had been impacted, over 25 individuals were impacted or learned through one individual getting a job. And it goes right through their community, through the other employees, their family, their community that they live in. So really, it was, how do we measure the value? We know it's valuable. And I always gave the example to government of an individual that we worked with many years ago who lived on his own, had an intellectual challenge, but was very lonely. And every day he would phone the hospital emergency room and tell them that he had pains in his chest. And they would send an ambulance for him. And for the next 3 or 4 hours, they would go through the process. This was happening 3 or 4 times a week. So this gentleman was referred to us for a service, and we were able to get him a job for 24 hours a week at a local business here in our city. The minute he went to work, there was never another phone call. There was never another phone call to look for an ambulance. So we were trying to say to government, what's that value? When you consider in most provinces to walk into a hospital, the initial cost is about $125 to your provincial medical program. So we knew that by doing this and providing some employment and giving him some supports that he was missing, we were able to change the way the system not only responded, but how he was responding to the system itself. So no longer did he have to use the system to get assistance to do daily things. So if you called and you told them you had pains in your chest and you were hungry, they would get an ambulance and they would feed you, but they would still do all the other stuff. So it was really, really important for us to demonstrate we did something and there was a result that was beneficial both to the community, the economy, government, and the individual. It tells the story behind the numbers. We all have organizations that we work with or volunteer with that have many, many facts and figures about their program that talk about the work that they do, but really, what's the story behind those? As we all know, those stories, those figures are made up of the stories of the individuals, and it's very hard sometimes to translate 3% into 3 individuals or a dozen individuals and let government see that these are real live people who have dreams and hopes and aspire to be, you know, a more inclusive Canada. They really wanted to make sure that their story was understood. So we really did take a lot of time making sure that we focused on how to tell the story. So this is a diagram actually you're seeing there now. It's to optimize, understand, and track. This is what we've learned how to do, and I must say to you that it wasn't always an easy process to try and get to learn how we were going to make these changes and understand areas of success and challenges. Because one thing with the self-evaluation and this evaluation was you were looking at the things that you were doing as an organization. You were looking at what you did and how that impacted on the folks that you were supporting. Because oftentimes you're given a mandate by government and you know that you can do the mandate, but you might need a little extra support to make sure that the individual gets their needs met. We learned that through this process, if we're going to track, to understand, that'll give us the ability to optimize. My grandfather used to say, if you watch out for the pennies, the 20s will look after themselves. And what we really needed to do is we needed to do more tracking. We needed to collect data and base our decisions on good information. Because previously I could tell you that yes, when an individual with a disability went to work compared to other workers, they have a lower rate of staff turnover, a lower rate of absenteeism, but being able to assign a value to that, not only for the individual, but for government who would probably be supporting that person if they didn't have the job. So we looked at this. This was a new mantra for our organization. It was what we were going to have to do. So we were trying to figure out, you know, why this method? Well, to be honest with you, we were intrigued. A study that can place value on something many thought to be immeasurable, we thought, well, we need to be involved with this. We need to figure it out. The challenge that we had was trying to see what it would bring us. We knew we would have a toolkit at the end, but the difference between what the staff wanted and what I wanted was I wanted the number. I just wanted to be able to say to government, look, we did research. This is our number. See how valuable we are. But what we learned through the process was that we were going to get a lot more out of the process of doing the SROI. We had really hoped to achieve what we knew we were doing good work, but we wanted to validate that with a value. And that was the goal. How do you put a value on something and how do you monetize it? How do you get government to understand? How do you start talking in government terms? We often lay and say, you know, we're bilingual. I speak English and federal bureaucrat, and I'm quite good at it. But this engagement process was ours, and in order to make it work for us and the clients we were serving, we had to be creative. I love this slide. We had to be creative in our solutions. Dear Santa, if you leave a new bike under the tree, I'll give you the antidote to the poison I put in the milk. Timmy. We were always struggling with how creative could we be, staying within the confines of our agreement with government as to what we would do, but looking at a new measure of accountability and a new framework of responding to the individuals. Everybody says, think outside the box. So we were looking, can you see beyond the complicated question to find the simple answers? And even during this process, when we as an organization were engaged, when I would come in at this kind of point, I would be saying, yes, we can see the complicated question, but what's the ratio? Tell me the number. Give me an opportunity to sell the number. And the ladies who I work with here in my office kept saying, Sean, what we're trying to do is find the value, but we're also determining all these things along the way. And so we started to talk about it and say, well, what things are we determining? Well, somebody's self-worth, how somebody feels about their job. So some of the key findings started to become really, really clear. We were thinking to ourselves, we weren't going to be able to find everything that we wanted, and we found more than we ever thought. And I think that maybe at this point I should mention that I don't like doing research. In fact, when you mention research to a not-for-profit, all they see is somebody with a bow tie from the basement of the government building coming with a calculator and a pencil to count your beans. And we can be assured that at the end of the day, you would have less beans than when you started. So as an organization, you're always fearful. We kind of felt a little different about this because we were going to be doing the research. We were engaging a consultant to provide us the direction. We were engaging as a pilot project. So we knew that there was more than us involved, and that gave us some calm and some feeling of, yes, we were doing the right thing. So we found out that for our folks, the key findings were endless training doesn't work. Employ then train is possible and successful, which is a real key for us because the folks that we work with are often in training environments for far too long. And what we learned very quickly was by placing somebody in a job and giving them the opportunity to be trained, they will pick up more skills. Employment equaled equity. And the easiest way I could describe it is when young people or folks with disabilities said, I'm like everybody else. I have a job like my sister. I work on Saturdays like my mother. I go to the grocery store on Thursday like my dad. So it gave them the sense of equality, getting the job, knowing that they could say, I am employed. The employment also allows for the appreciation of routine and schedules. This is something we never expected to find out, but was extremely valuable information in how we work with the folks that we support. Besides having a job and having something to get up for in the morning, what they discovered was that on their days off, they had something to get up for. Their day off, they had to go to the grocery store. Their day off, they were going to a movie. So they found that it provided them with a regular schedule. So it wasn't only the value that we were getting through the work, it was the value in the rest of their lives that it gave a purpose. It gave a schedule. Independence equals confidence, which equals autonomy. And people wanted to be free. And when we use the word free, it's a very broad term. But for the folks that we talk about, independence equals confidence equals autonomy, free to make your own decisions. And one of the most touching things that we heard was when, at the end of it, we were talking to a number of folks, a number of individuals we serve, and we said, you know, can you tell me how going through this process of finding a job and getting work has changed you? And one young lady said, I can now order my own meal at a restaurant. And the rest of the staff in the office, we all looked at each other, and we were shocked, dismayed even, because we thought that we had been providing enough confidence and independence. But what they told us was that they still had a long way to go, but that they were making steps towards it. This young lady who talked about the restaurant, her previous comment to that was, I can answer the phone in my house. And I said to her, well, why wouldn't you have answered the phone before? And she said, because I was afraid I wouldn't know how to answer. And so when she talked about that she can order her own meal at the restaurant, beaming with pride that nobody had to tell her what to do, I will have. And a lot of the folks we worked with talked about the I statements, statements that they could say, I, and mean it. I have decided. I am going to. I will. And that was a value that I don't think anybody had looked at, the increase in the self-confidence and the ability to make better decisions when you're supported. Employment doesn't always lead to a better social life, contradictory to what some may assume. This was something that both shocked us and upset us as an organization, because we saw the change when folks were able to get a job and be more independent and be able to go out and make their own fiscal decisions. And so when we started questioning people at the end of the program, what we discovered is that they answered, yes, I am more economically independent than I've been ever in my life, but I'm still socially excluded and don't have as many friends. And so that really told us something. It told us that the economic piece of it was important, but that there was this building piece of a social life that was also critical important to the general well-being. And by the general well-being, the more permanent employment. If somebody's struggling socially at their job and the paycheck is important, if they can't keep up the social piece, they're going to find it a struggle and may lose hours, and in the worst case scenario, may lose their job. So some other key findings was this particular saying has become the catchphrase of the organization, and some days I always hate to hear it. But every time we talked in the office, we had on value, every time we talked about a new program or service, it started with one question that we would ask: so what? So you did a program, so what? Get to the root of what you're trying to do. That gave us the ability to look more clearly at what it was and the steps involved to getting there. So every time, and still to this day, in our office, when we have a conversation about doing something, everybody says, so what? What will it mean? And sometimes it's a hard question to ask yourself, because sometimes you ask your question yourself, so what? And you decide, so what? We really didn't accomplish it. But that's also a good thing, because you don't spend any more time on it. You're able to move on and look at more important things. So if you're not affecting change, if it's not causing better outcomes, then we need to look at it to change. So we talked about, let's change the way we do things. We really, really looked at the research that we got and said to people, how are we going to be able to take what they've given us and now make our organization better? And we heard a lot of great things through the research, but one of them was it provoked conversation and thoughts. What are the gaps? What can we do differently? And there's nothing harder than self-examination for a program that you think very highly of yourself. And in my particular case, I designed the program and built it. And over 20 years, you adapt as you can, but do you ever really go back to the time where you say, where are our gaps? What can we do differently? How do we change? And as organizations, you're so busy trying to keep the doors open and trying to support the folks that you're working with, we really wondered, could we do it? Well, we measure distance travel and change, and we do that now on an ongoing basis. So whenever anybody comes into us, instead of start talking right away about work, we start talking about how do they feel? Where do they feel they are? So we're able to get kind of a baseline. And then we're able to look at it 6 months down the road, 8 months down the road, a year down the road, 18 months down the road, to give us some idea that what we're doing has not only made an impact in getting them employment, but has allowed that employment to continue and grow as the individual becomes more comfortable, gains more skills. So we've always had this process where when an individual comes to us, they have an online form, they can send it in the mail, but it comes into us and we have our first meeting with the individual. Usually a fairly in-depth 1 hour, 1 hour and a half meeting where we talk about, here are the things we're going to be able to do, here are the services we offer, what are the things you like to do in your spare time, sort of trying to seek out some information from the individual that we're working with to see what it is that they want, what are the things that they have and skills and traits that we would market in the future on their behalf in the business community. Well, when we discovered that the clients coming into our process, the intake was too much for them. They found it really overwhelming, but they were too nervous to say anything because they were too excited at the prospect of being able to go to work. So we discovered through our questioning that it would be easier if the individual came in, we had a brief meeting, we talked about what we do, and we gave them a list of questions. Go home, talk to your family and friends about these, and we'll talk next week. So when the individual came back for the second intake and interview gathering, we got so much more information. It was amazing to see the change from meeting 1 to meeting 2. And we were clearly told by the individuals we were supporting, meeting 1 they were too afraid to say. Meeting 2, oh, I've looked at all those questions, I've talked to my brother, I've talked to my mom, I've talked to other people, I went back to see my teacher. And it gives people the opportunity, in particular for us, not to overwhelm the individual, because again, we had to keep in mind that going to work was a new challenge for lots of people, and lots of the folks that we work with had never been to work. So by putting it all on them at one meeting, we didn't get as much information as we wanted. By splitting it and giving the client an opportunity to adjust to our process, we got 10 times the amount of information. Those little gold nuggets of information that talk about some secret skill set they have that you didn't know about, or their desire to work in a particular business that you just heard was hiring. So it's all of those things. We all of a sudden had better information. And of course, by having that better information, we could support our folks to make better decisions, and we could make better decisions within our office. And we created a new position in our organization called Resource Coordinator to aid with the pre-employment skills and social development. Barriers that make people unemployed. And I explained this to somebody yesterday. We're working with folks who have a lot of ongoing challenges, may have some housing issues. Personal hygiene is always an issue. And I remember saying to somebody just the other day in government, people can lose their jobs because they have dirty fingernails. And somebody said, oh, Sean, you know. And I said, yes. And they said, not only that, I said it will socially exclude them from the dinner conversation that many organizations have around their staff table. Nobody wants to see somebody with dirty fingernails lifting a box or serving a customer or whatever the case might be. So but if that person doesn't have that skill set, we know that, you know, this new resource coordinator will aid in making sure that personal hygiene is addressed, transportation. Maybe the individual you're working with got an ongoing medical issue that they can't find a doctor for. In order for them to keep working, we've got to try and support them as they face each of their challenges. You know, it really was pre-employment and skill development. But I wanted to clarify for everybody that this is not a 10-week program, a 9-month program. This is very specific. You could be working, and the resource coordinator might be putting off a workshop on banking and debt. And so you're off on Wednesday, you're going to come to the session. But also might be involving personal hygiene. We have lots of folks who live independent but struggle with hygiene. So these are the resource coordinator's jobs. Previous to this, we weren't addressing these issues. We were often going to government, to the social workers, to other agencies, and we weren't getting the results that we wanted. So by offering this ourselves, after we had good research and good information to tell us why we needed it, how it should look like, and what services it would offer. Again, you know, there's nothing like as a not-for-profit. One day you're a bookkeeper, and the next day you're the job developer, and the next day you're something else. We wanted to make sure that we had somebody committed to the resource coordinator position so that not only could we track the change, but we could actually help people identify it themselves. So this was really important to us because we had to have the buy-in from the individuals. Because we were breaking up our intake process, we were changing the way we were engaging with our clients. They had an adjustment period as well. But it was one that gave us more information, I think, more information of the things that we wanted. You know, making change is scary, and, you know, fear is a story we tell ourselves. When we started our process, we would look at somebody goes to work. Besides the economic value of the tax that the person pays is collected, what are the other things that they're doing? Well, we had lots of stories about how people spend their money, how people work in the community, how people live in the community, but no definitive empirical results that would give us the ability to make a better decision based on fact. These were things that were almost always gut feelings. These were things that were always, you were surmising based on your past experience. But it was really, making this change was terrifying because it meant we were entering into a process of not only self-examination but research. And there's nothing worse than doing research and then not doing anything with that research. And we wanted to make sure that any changes we did make to our organization, structure, policies, or processes, were well rooted in understanding and good, clear explanation. So what have we done with our social return on investment? Besides flogging it every chance we get to anybody who will listen, because it demonstrates our value as an organization, we've made the changes that we want. And we're now finding that as we track the change of the individuals, we are better able to report our progress in supporting that individual. Sometimes we support people and they may not go to work, but they may decide, you know, I really like the ideas of doing that job, but I think I need some training or a program that will give me the skill set to get that job. So it gives people the opportunity not to be wandering around wondering what they're going to do. It gives them an opportunity to try new things. And as an organization, we also had to be open to that. The other big thing that it did was it causes us to continue to ask questions of ourselves. And that's the so what question. We're going to do a program that helps people who are in poverty. We talked about this in my office last week. And I didn't have it out of my mouth when two of the staff said, so what? How is that going to affect us? How is it going to affect the individual we serve? And what's the actual outcome you're looking for? And are we going to be able to measure it? And it's not that you become a bean counter. It's just that you can now think like one. You can now think about different scenarios that would give you different results, different questions to see what the folks you're serving are saying. So we will, and the social return on investment has been over for about 9 or 10 months, but we're still using it in guiding our processes for our organization. We asked ourselves, what could we do better? Besides the so what about a program design, what are the things we're doing now that clients may want us to do more of? What would they like us to do less of? And could we do it better than what we were doing? And of course, as your own organization, you feel you're doing a great job. And for the most part, we were. But we discovered through the research these little tiny, what I would call holes in our theory, holes in our belief system that we were doing what we needed to. And so we were really getting to the crux of how to make our organization better than it was, but not completely change the design. And so just how to be more effective. And you know, community groups engage on both national and provincial levels in engagement strategies that they want to be effective. But very rarely do we ever stop and lay out a plan that has reporting points that says this is how we are going to be more effective. These are the things that we've changed in our organization to be more responsive to the individual we serve. These are the things that we've done to make our organization and the money government gives us more. We're able to do more with less. And we continue to support more people after they got a job. As an employment agency, our goal intrinsically, get somebody a job. But what we discovered is that getting the job is the easy part of the equation. Supporting somebody so that they're able to develop their own skill set to keep the job is the difficult challenge. And being able to look back at your organization and evaluate what you've done in the past gives you insight into what we wanted to do in the future and how were we going to support people. I mean, I started this organization 20 years ago, and for the first time in 19 years last year, I changed the position and changed it drastically, changed the way we address and work with the folks that we represent. And it was a fundamental shift, but it has been an amazing opportunity to be more clear, to be more efficient. Don't work harder, work smarter. And that's really what it gave us. So little things that we were doing were going to make the world of difference to the people we were supporting.
Sean, I have a few questions here, if you'd like to
Shoot.
take a second address them briefly.
Absolutely.
Okay, so first one, I'll try to get to a few here. Did the other agencies in your group have equally significant learning as a result of engaging in this process?
I think they'd have to ask them, but what I do know is that everybody learned something about the program that they didn't expect to learn. As directors of organizations, we were all so excited to get something. We almost looked at it as a magic bullet that I'll be able to say to government, this is my value, and you should value me at that. And all the organizations were looking for that, and some of the organizations were completely volunteer-based. I'll give you an example. The Community Food Sharing Network that works on issues of food security here, totally volunteer-based. But their return on investment was astronomical because they were also doing education and giving people the skill set. So you'd have to ask that question of every organization independently, but when we collectively got together, everybody talked about how they had learned something they had no idea about. And, to be honest, I mean, I was a little embarrassed when people said I'm economically included. I'm like, good. And then they turned around and said, but I'm still socially excluded. As the person who runs the organization or runs a program, you think you got a good handle. But we were digging deeper than we'd ever dug before in the research and asking some pointed questions. So I think that as each organization addressed it for themselves, depending on how far they were willing to look inside, will really depend on the results of the work that they got. And I will say that it was a lot of work. It was a lot of, as the ladies in the office said, it's a lot of brain work. It's a lot of thinking critically. And when you're used to dealing with folks where you're making decisions on the fly, we often now have to pause just for a second to look back and say, what are the things that the client asks us to do in the beginning? Should we be making these decisions on the fly? And how do we stop for momentarily to get the information we need to support the individual to make a better decision? So everybody found something beneficial about it.
Okay, perfect. Does your organization have a committee or something like that, I would imagine, of end users or clients?
Yes, we provide every year, and well, now we do it once a year, but we do it on entry. We start tracking people's change, and we track the change throughout the year, and that's assigned to a committee that includes an individual who's a consumer, so that we're regularly able to get feedback. Being prescriptive and asking, did we do a good job, is not as clear as what could you like to see more of. Because if you ask the individuals we served, did we did a good job, and they got a job, they'd say yes. But they also might say, I need more support at the beginning. I need more support around social issues. So they were not telling us everything, and that's what we were really trying to dig at. So by having a committee of people after the fact, we're able to continue the valuation. And given the fact that we put a lot of time, money, and energy into it, we want to make sure that we wouldn't lose what we've done and that we could take that information and translate it into other pieces of the organization so we could continue to evaluate ourselves.
Perfect. Are you still meeting with your other agency colleagues to learn from changes they have made as a result of the SROI project?
Well, actually, we live in a province where there's only 544,000 people, and I have 17 brothers and sisters-in-law. We live practically with each other. From group perspectives, we continue to get together on a regular basis just to have conversations about, here's what we're doing, how has it affected you? And we run into each other at meetings, and we still laugh because, we'll often run into each other at the meeting. We'll point our fingers at each other and go, so what?
Yeah. How do you talk about partnerships in ways that elevate everyone and get over the competitiveness?
Yes, because I shared my results. So I'm one of a network of organizations. We're independent, but I'm one of 20 organizations in my province that support folks with intellectual challenges to find and keep employment. So I have 19 other counterparts. I was one of the only organizations in my group that was able to take part in this pilot project. I had the money, I had the staff resources. You think you got the time when you start, but you have the opportunity to. I'm sorry, Amber, I lost the question.
Oh, sorry. How do you get over the competitiveness when you?
Right. So when I got my number, and I'll show you the number at the end, but when I got my number, I shared my results and my research with everybody in the province, because as far as I was concerned, I knew I was a good organization. The project didn't take anything away from that. The project only allowed me to be better prepared for these conversations. I was able to share with people that, look, if you change this process, you might get this result too. And I wasn't worried about my organization, because I know sometimes it's really hard to share what you've done, but we were really confident that what we were doing would improve service, not only for our organization, but for other people. So at the end of the day, we kind of got beyond it just from the fact of, look, it is what it is. The research says this. The folks that we've served have said this. So we can't take away that, and you can't take away the validity of their comments just by sweeping it under the rug. So we took a big, bold step and shared it. It's a little bit of exposure. You kind of feel like you're standing in a crowd full of people in your bathrobe, because you are exposing some of the warts. We thought we were doing a great job on getting people in the community to be more included. Yes, economically, but sad socially, that was one of the challenges we continued to face.
Okay, perfect. That's good for now. We'll just keep on moving.
So when we did the SROI, the project itself took 18 months. We had 1, 2, 3, 4. I think we had 6 joint sessions where all 15 of us came together, and it wasn't 15 groups, 3 people each group. So we had quite a large group of people, and that was one of the benefits of going through it as a cohort, is that we were able to talk to each other about what we were doing. Everybody was looking at something different, but the process of examining it was fairly similar, and how we were doing the research and determining the value. We were all looking at it in similar ways towards our organization, but we really wanted to figure out what were the things that affected our particular organization. All right. So here's the benefits. This was an amazing thing to find out. We provided over $500,000 in value by increasing individuals' independence. They felt independent. But as you can see there, the increased self-esteem only went up by 67,000. Better social relationships by 37,000. Not good numbers. We expected them to be higher. Everybody talked about how their financial situation had been improved, and that's the value. And so we were able to determine through calculations and proxies and formulas how that value was assigned. I could give you the formula, but it's a really complex, fill in the blanks, go determine how much social assistance somebody gets with their age group, how long they've been on. So there was a lot of background information that we put into the spreadsheet to give us our numbers. But again, all of it validated and peer-reviewed by this foundation we were partnered with in England. So the total value that we created as an organization in 1 year is over $1,099,000. So we know we're creating more value than our organization was funded for. We know that we're providing value to government. So this is actually our impact map. This was one of the hardest things we had to do, because you had to look at the difference between output and outcome. So your output was something that happened, so somebody's wage, or they had their services reduced, or there was an interaction. But the outcomes were very different. It was about equality, contribution, better time management, better self-image. And then those would lead to improved job readiness, improved job skills. These were the things we were trying to get to. So the final outcome was exactly what we wanted it to be at the beginning, maybe not to the extent we wanted. So that's when we started to change the organization. We knew when somebody went to work, they were going to be improving their financial situation. But when somebody went to work, we also expected their self-esteem would be getting better. But we discovered that while they're more independent, they still were excluded socially for a multitude of reasons. So that, it has to come with the better ability to form and maintain relationships. And as we all know in our own work lives, the ability to maintain those relationships is really, really important because it gives you ideas on how to make those relationships better, how to improve the quality of your service. So when we finish our outcome map, our impact map, we were astonished to see how we were able to actually track the changes we were making. And we only do one thing. We provide employment. And so that was that also made it a little bit more intriguing because we weren't asking questions on 5 programs. We were asking questions about going to work. And of course, as one would expect, going to work affected every area of a person's life. Social, recreational, fiscal, personal relationships. Those were all things that were affected by individuals that we were working with. And we were told, and we saw people's ability to have better outcomes at work increase when we started addressing the social issues that they talked to us about that they were lacking. They don't have many troubles at all in making fiscal decisions, but they had a lot of struggles with making socially minded decisions. Should I go out on Friday with the group of friends versus staying home so I'll be ready for work on Saturday morning? Personal hygiene is often a struggle for some of the folks we work with. They don't have a lot of supports. So working and making sure that while the outcome was employment, all of those things that affected employment and affected somebody's ability to stay employed had to be critical thoughts. So those outputs led us to our outcomes, and the outcomes that we wanted are getting better. They continue to improve, but they're only going to improve because we looked at the outcomes and addressed where the gaps were. And that's really critical, is that whenever you do this type of analysis, you come out with here are the list of things that you know. We know we're doing these. Well, where are the holes? And so often people sort of stop and they say, well, I got my outcomes. I know what we're doing. Thank you very much. But we continue, even to today, a year after we've done. How does everything we're doing impact people? So there comes that question again. So what? So the value created by the stakeholders, so this was government, this was the individual. So the individual had, if you can see there, the 60%, every one of the people we helped place this year saw a 60% increase in job readiness and skill development because we were addressing it right up front. Increased independence, 28%. And you can see the lowest one is better social relationships at just 15%. So we're working to increase that to 37%, which would match us with the improved financial situation. So we have a goal. We're working towards it. If you were to ask me now what my percentage is, I'm going to tell you it's about 19, but it's taken us a little while because not only is increased social relationships about work, it's about what people do outside of work. And while that's not our mandate, we're trying to support people in making better decisions for them. And so when somebody calls and says, I had a great day at work tomorrow, I have to go to work tomorrow, but I'm going out tonight with a crowd of, with a group of friends, and I won't be home till really late. Well, it's giving them that idea, well, your employer expects you to be ready, and maybe if you get called in early. So we're trying to support them in understanding how the decisions that they have could impact their social relationships and thereby impact their whole lives. So the final ratio was $3.80. For every dollar that government gives Avalon Employment Incorporated, $3.80 of social and economic value is created for the beneficiaries. So that's the individuals and the employers and government. So we know that we are a very valuable organization to government. Now, when I went into government with this, and it was reviewed at a very senior level of government, but I take it everywhere. I have it in my briefcase. I have it on a little cue card, actually, and I love to haul it out to give people an idea. So I was in a meeting because, so you know what government is like. They'll call this the latest fad, the latest trend, the latest measuring tool. But you can get them to admit that they agree. So when I went to this one particular meeting, I was talking to an individual, senior level person in government, and they're sitting across the table from me going, Sean, do you really think that it's $3.80? And I said, oh, yes. He said, well, we don't. And I said, okay, what do you think it is? I said it could be $1.50, it could be $2, it could be $1.10. Oh yes, he said, now maybe those are more reasonable. And I said, yes, but I said, now that you've agreed that it's above $1, you've got to admit that the program is cost negative. And I had them. I had the result that I wanted. They couldn't argue with the fact that we were providing a good service. They couldn't argue with the fact that we provided value for money. And at the end of the day, they might not want to accept my $3.80 number, but they accepted that it was more than the program cost. So their net benefit was more than they were spending. I had them. So that's part of the thing that we were really shooting for. We were really shooting for to give them an idea, to get them to admit that we were valuable. And as everybody knows, when you get government to admit you're valuable, they're a little bit more interested in, we value them. We value what they do. How could we work with them more? Anybody have any questions?
Yeah, actually we do. We have a question from Seema. She's asking, she says they are struggling to quantify improvement in self-esteem. So how do you do it? She says, I understand it is complex, but what is the process?
Well, basically the process would start with, I'm just going to, can you guys see my screen?
Yes, we can.
Okay, I'm just going to jump over to see if I can find I want to see, because I want to answer this question because it's really a good point. Self-esteem was one that we worked on, and I want to get the self-esteem document. Okay, so I'll give you this. This is one for self-worth. This one is for what is the value of exercise, being healthy. So what's the value of somebody's health? Organization A discovers that a major outcome of their work is improved health, and that the flow from this extra exercise their program participants get. How do we put a value on this? We could look how much people are willing to pay to get the same result. In this case, a good proxy or cost determination might be, what's the cost of a gym membership to go and be healthy? Or we could look at the healthcare system. More exercise means that over a lifetime, the participant costs the system less, and another way of getting a dollar value for what seemed like an intangible outcome. So you have to determine what indicators you use to track your outcomes, and you gather data to find out how much change is happening. So this usually means with a mixture of primary research, surveys, interviews, other data. With solid data comes accurate measurements of the costs and benefits. So we also collected on impact of how much would have happened anyways, dead weight, how much credit to others, attribution, and whether a net benefit has been created or simply moved around. So we were going to do something somebody did anyways. So all of those things are factored into it as well. And we also, at the end of it, we must justify on how long their outcomes last and how much of the benefit drops off. So if you gave somebody a job and the self-worth piece, you would have to determine a proxy for somebody's well-being. So you could look at, one is a health benefit. What else could you do? You'd have to determine the proxy that would give you the best outcome. If the person who's asking that question could give Amber an email, I could actually give you the piece out of our proposal where you can see how we measure this.
That would be great. We'll follow up with her.
Yep. Because I don't want to go through the whole particular, the report is 37 pages.
Mm-hmm.
So I know that there's something in there. Like here in this one in section 5, some of our results we did see improved self-esteem. As somebody had said, I'm now able to answer the phone at my house, or I'm able to order my own dinner. To get you the exact proxies we used for that calculation, I can, but I wouldn't be able to do it right this very second.
And I mean, some of the questions I think kind of obtain to that about, you know, how is the financial value obtained? So maybe we can direct them to the report as well.
Yes, and
presentation.
What I would say to people too is that the proxies are relevant to your province. So I asked the same question: how do you determine something's valuable? So the easy example was given to me was you have a child, and so you say to the person, you have a choice. Do you want to go and play with, how much is friendship worth to you? And everybody will say, well, you can't really determine that. Well, we can. So you say to the young person, do you want to go play with your friend, or do you want to play with this iPod? I want to go play with my friend. Okay, well, the rental of the iPod is $12, so friendship is worth more than $12. Then you say to them, do you want to go and spend time with your friend, or will I give you an iPod? And you can play with that. You can keep it then. So we now know that the person is going to say, well, I want the iPad, and the iPod or the iPad is worth $129. We know that that value of friendship is somewhere between $65 and $129. Now, I know I'm simplifying it very, very easily, but there are many other factors that you have to put in there. But it's fairly easy. If somebody wants to get healthy and they happen to have a job that does that, well, that's a value. But the easiest way to assign value is what would you have to pay to get the same result? Well, you'd have to go to a gym. You'd have to buy the membership. Somebody's health, because you're able to provide them with a job, their health improved. Their cholesterol went down. Well, then that's less medication that they need to take. So those are the proxies you would determine. Health insurance. Health insurance costs X amount of dollars a month. That would be a proxy that you could use.
Okay, perfect. I think we'll just keep moving. We do have a question about addressing stigma on those who face some of these challenges and how you've addressed those situations. So I don't know if you would like to address that now or later.
No, can you ask me that question again? I didn't get the first part of it.
Have you had to address stigma that is sometimes placed on those with challenges, and if so, how have you handled these situations?
Well, as an organization supporting folks with barriers or disabilities, we kind of went into it with that we knew that there's a stigma attached to, many folks who have, the challenges that in the community are not like everybody else. But we weren't really looking at that. We were looking at the value. From an overarching perspective, yes, we wanted to look at that, but we knew we could demonstrate value by putting the person to work, and that they would demonstrate the value themselves, and those prejudices often bleed away over a period of time. I can't tell you the number of times I've gone to an employer and started advocating on behalf of a person with a disability to only have the employer turn around and tell me something like, we don't need one of those. Or, I would love to hire a person with a disability, but I already got one. And so it's a case of the education around the stigma, and that many people believe that, once you hire a person with a disability, your workers' comp will go up. Well, there's no factual point to that. These are myths that, you're often trying to destroy for people so that they understand that it's not true. But the stigma is still there, but the stigma is not as important anymore. Because there are labor shortages, because there are challenges in maintaining good employees in entry-level and mid-level support positions, people are losing their stigma of hiring a person with a disability. We've got to stop selling programs for folks who have exceptionalities or disabilities as a social program. We continue to sell our program as an economic program that provides support to the business community for a shrinking labor pool and provides support to the individual to be a fully participating Canadian. I made a conscious effort about 10 or 11 years ago to stop referring to my program as a not-for-profit social program. We are a community-based economic development program. The fact that we find people would have disabilities jobs is irrelevant. At the end of the day, the result was economic benefit, and that's where we're trying to say. Because when you start talking to businesses about people with disabilities and folks being important in their workplace, they've got to get the understanding that they're important and why.
Okay, perfect. I think in the interest of time, it's after 1. I think we'll keep moving for the time being.
Okay. And that's it, actually. Amber?
Allison.
Allison, sorry.
Okay, perfect. So we're on to the Q&A part anyway.
Mm-hmm.
So we have a question here around, is there a link with essential skills?
No, but I will provide the report to Essential Skills so they can put it up on their website.
I think she's talking more broadly, like OLS's essential skills. I don't think you're not an LBS program, so.
No. No, to let people know where I get my money, we're under the Labor Market Development Agreement for our province. Each province has their own. We're specifically targeting people with disabilities. My funding for my organization on a yearly basis is so much for the federal government and so much from the provincial government. It is managed by the provincial government as per the Labor Market Development Agreements of a number of years ago. Not uncommon to Skills Ontario, Skills New Brunswick, PDD in Alberta, so everybody kind of has a similar layout, I would think.
I think there's a question. So how can we link this to showing the value for a library service or first, I probably think they mean First Nation communities on reserve land?
Well, the first thing I would do is talk about the intrinsic value of literacy and what's that worth. So what is the first thing so here's one for there. What is the cost to the social safety net for people who are illiterate? What is the cost to the social safety net for people who are literate? And there's the difference between them. So you know what the cost is to the system when somebody doesn't know how to read. So your demonstration of your value for your particular Aboriginal community and your reserve would be that the library gives people the skills to make them more independent and less dependent on the social programs that are offered either by the Band Council or the Department of Indian and Northern Affairs or their local, Aboriginal community that they're working with. The other thing is I think that I recently saw something too is libraries, in particular with literacy issues, they're changing from paper to electronic. So while the library doesn't always now have to be a physical building, it can be a virtual building and it can be a virtual service so that people are able to get it in their own ways instead of, looking at a class but the value of your library in your community is the difference between the cost of the social safety net of somebody who's literate and somebody who's not literate. And that would be a fairly easy proxy to figure out.
Okay, perfect. So just going back to that essential skills question with more explanation. So were essential skills used to facilitate access of individuals to workforce? So reading, writing, computer skills, providing them the skills they need for successful performance. So like what kind of training do you do?
Well, we do most of our stuff on the job. Most of the folks that we're working with would have significant cognitive challenges. And so the issue becomes is that historically, when you support the folks that we support, training is the answer. And, I'll give you an example. About 15 years ago, I closed down a pre-vocational. So when you hear the word pre, you think that it's going to be pre-employment. I asked the young man, I said, can you tell me how long you've been here? My very first question, pre-employment center, he said 27 years.
Wow.
So that's the trap we get into, is there a need for more training to get ready for work? And what we've learned is that folks have an opportunity to gather more skills in a diverse learning environment than they do if they were just continuing to train. And here's the other thing. I'll give you the example. I don't know how many people are dealing with schools with kids with disabilities. I deal with a lot. And I recently got in a bit of trouble. Well, I wouldn't say trouble. I caused a bit of a stir. When I went to the regional school, and all the teachers were there for a workshop, and they brought me in to talk to them, and I had said to them, stop spending 3 weeks learning how to make coleslaw. And they said, why? I said, because there's no coleslaw factory. So it was more about the skills that I needed. And so we're now engaged in another process that we learned through our SROI, where we're talking about curriculum development with the schools for the folks that we're serving. I know right now that in my city, there are 189 kids with disabilities in the classroom going to be graduating in the next 36 months. I know what my cohorts coming up are, but I've got to make sure that as they're coming out, they've got the marketable skills that don't cause them to go right into a training program. The other thing is that while there are a great many modified programs across the country based on need and based on individual programs, there has not been a lot of acceptance by employers to accept modified programs at the same criteria level as now.
Okay. So it's not just about getting them into a job, but is it also about supporting them while in the job? Are you there, Sean? Sean, are you there? We'll just hold out one more sec. I think we're losing him. Sean? Okay, I don't know if we'll be able to get Sean back, but I do want to say in the meantime that we will be sending up a follow-up email with more information and the report, as well as a link to hopefully a recording of this presentation post the webinar. So, Sean, are you there? Sean, are you there?
Me?
Hello?
I saw it. Hello?
Hello? Okay, so you know what? Unfortunately, I think we have lost Sean. We are doing this from a distance, so sometimes those things happen. So we will be following up, and in his absence, I do want to say thank you to everyone, and thank you to Sean. I'm hearing really good things, and we will get back to you about the slides and the recording. So, Sean, if you can hear me, thank you very, very, very much. It was very informative, and we will talk to everyone soon. Stay tuned for more webinars. Thank you, everyone.
Amber?
Hi, Sean.
Hi. I don't know what happened. My network went down.
We actually we thought maybe there weren't any more questions anyway, so we thought we'd just kind of wrap it up for the time being.
Okay. I'm going to have to, I want to send you the SROI so you can post it.
Okay,
and so
perfect.
people can have a little bit of a better look. Interesting doing a webinar when you can't get a response from the audience.
Perfect, yeah. Okay, so we're going to stop the webinar. We do have some people still on, so thank you, everyone.
Thank you very much.